So good morning, my name is Brittany. I work at the Georgia Health Policy Center, and today we're going to talk to you about a training series that we designed for Georgia's youth recovery workforce to make their sites more inclusive for LGBTQ youth. So I didn't design this project by myself, so I do want to give a quick shout out to the rest of my wonderful team. We also partnered with folks at the Maryland Department of Public Health, a theater company named Theater Delta, and many community members to make this project successful. So let's start with some background info. LGBTQ youth consistently report higher rates of substance misuse compared to their heterosexual and their cisgender peers, with LGBT youth twice as likely to drink alcohol prior to the age of 13, and trans and gender nonconforming youth reporting higher rates when they get to high school. Black, Indigenous, and other LGBTQ youth of color or BIPOC youth also report higher rates of substance use, both among their heterosexual peers and among white LGBTQ youth as well. So taking a more narrowed focus on Georgia, there are about 69,000 youth under the age of 18 who identify as LGBTQ, which often have higher rates of marijuana usage, increased child welfare involvement, and increased risk of trafficking, which increase their risk factors for substance use. So we know that their substance use decreases when they have supportive environments that they can identify, so this is exactly what we wanted to do with building up the workforce. We put together a training to strengthen empathy among the workforce towards LGBTQ youth. So why theater? We needed buy-in from staff to initiate change both within themselves and in their workplaces. They had really good intentions, but were often hesitant and didn't know where to start or didn't want to say the wrong thing. So this is where theater allowed them a safe place to fail. Theater is used in a lot of different public health interventions to promote social and behavior change through experiential learning, and so we partnered with a theater company called Theater Delta for our trainings. And so with the steps that we took to put this together, we identified a need among the program staff. We developed a community advisory board, worked with our training consultant, and held 2 different webinars and 3 in-person trainings between April and November of 2023. We created a community advisory board to facilitate engagement with those with lived experience and to provide guidance throughout the project. We met with these folks monthly over 7 months, and they had full decision-making power over all of the training materials. Our trainings, they targeted staff both at recovery support clubhouses as well as residential programs, which serve Georgia's youth, adolescent, and emerging adult populations and are located in both metropolitan and in rural counties. The in-person trainings involved 2 performances with interaction with the actors while they remained in character, including with Q&A. One scene in particular featured a neurodivergent, non-binary Black teen while they were at intake with their grandparents, and a second scene was a tense conversation that was between 2 employees. So now let's talk about how the audience rated us through our evaluation, where we used post-training surveys and an arts-based method to hear their thoughts. Our training series had a substantial reach, with 38 professionals across 16 different agencies attending our pre-training webinars, and 47 professionals across 33 different agencies attending the in-person theater trainings. And from our survey results, we had 100% of attendees strongly agreed that they gained new knowledge, felt that the performances gave them an opportunity to reevaluate their opinions and ideas, and they left with ideas to bring back to their program sites. And all attendees reported that they would recommend this training to others. We also had them do an arts-based approach to assess for emotional connection, to identify words that helped them identify how they were feeling from the performances. Empathy, engaging, love, creative, and compassion were identified the most. And this is just a word cloud that we put together with all 201 words. You can see they identified words across the gamut of emotion, including acceptance, open-minded, and heartbroken. Next, they also created poems using those words. One poem said, "To be human, I need to be relatable. I need to be engaging. To be human, I need to think about others." Some attendees even took it a step further and read their poems out loud to one another at the training. So in sum, we learned 3 key lessons. We learned that the training was successful with creating emotional and behavior change towards queer and trans youth. There's a strong willingness from the programs to make their services more inclusive, and theater was an effective modality to both initiate this work and to keep them engaged. So I hope after this you'll be interested in adapting theater within your agency to help create a safer and more affirming world for our LGBTQ youth. Thank you so much.